what is a natural looking facelift versus just, say, a facelift?
Well, the truth of the matter is everyone has seen someone whose face just looks pulled and unnatural. Maybe it's an actor who's in his 70s and he's trying to look like he's 40. I mean, that'll just never work under any circumstances. But there are times where the sideburn is elevated in a female patient, irreparable damage, I think, that it needs to be covered up. It's never going to look natural. So there are techniques with the design of the incision that just take time and detail work that preserve a woman's sideburn so it's not lifted up above her ear. Similarly, behind the hairline, we see patients who have a triangle of hairless skin because of the nature of the incision. It was made into the hairline, it lifted the hairless neck skin up, and you get a zigzag of the hairline, preventing women from wearing their hair up ever again. So these things can be avoided. Also, not pulling the skin too tightly, recognizing that we need to also lift the deeper structures, the platysma muscle, something that's called the SMAS or the SMAS in the cheek. I personally also like to lift and resuspend the cheek pad. So we're not depending just on tension in the skin to give a good result. We're using the deeper structures. We also supplement with fat grafts to create a fresher looking skin, add volume where we need it, not necessarily just depending upon pulling the skin itself.
Do you feel that the surgeries that have been done on those people who you refer to as being maybe having gone too far, is that the patient's fault? Is it the doctor's fault? Why do it that way versus the natural way? Is it just a limitation of artistic skill, or is it just that we've learned a lot since the first surgeries?
Well, we have, and I think it's a combination of the two. I think sometimes patients have unrealistic expectations. They think that if they keep having a facelift every 5 or 7 years, they can do it indefinitely and still look good. And that may be the case with people like maybe Joan Rivers, where there's a lot of lighting and a lot of makeup. And although she looks strange for somebody her age, it's presentable. I don't know how she would look in person, frankly, but at least on camera, I think she looks pretty decently. So sometimes it's technique, but sometimes it's the patient pushing to have another and then another and then another and not realizing. And maybe the doctor being at fault also for simply not informing the patient that at a certain point it stops looking fresh and natural and starts to look more plastic.
Yes, and are the rates of permanence pretty much the same between a natural or less extreme facelift and a regular, say, facelift? Do they both basically need readdressing at around the same time, or does a natural facelift need more attention over time?
I'm not sure that we can differentiate between the two in that regard, but generally a well-done facelift should last 10 to 12 years. I found that a peak in my practice at about 11 years where patients who've had previous facelifts that I've done will come back. The extreme has been 16 years.
Wow.
But generally a well-done facelift should look good for 10 or 12 years. Now, for actors and actresses, their standards may be different. They may feel that their career depends upon them looking as good in front of a camera with bright lights on as possible, so they may come back sooner, maybe in 7 years. But it's the patient who has had maybe a poorly designed face with poor incisions, a lot of fat removed from their face, and somebody keeps pulling and tugging on the skin, or the opposite. Sometimes people are trying to avoid a facelift and going back for more and more and more filler injection. Then they really start to look bizarre.
Yes.
So it's multifactorial, but I think the patient looking to undergo a facelift has to take the responsibility to find a surgeon who's going to take the time, do the work properly so that it looks more natural. It's not the fastest done facelift necessarily, but it's one where the incisions will always be hard to find, and we can do it. We've achieved that level of success. My results, I think, look great. I just saw a patient the other day who truly looks about 18 years younger, 3 weeks after the surgery, and no one would see her at a party and go, oh, she's obviously had a facelift. That's success for me. I'm very happy with the result.
Interesting.
And that's what I always strive for.